Hello, this is Dr. Lewis Cady coming to you from the Cady Wellness Institute here in Evansville and Newburgh, Indiana, with the topic today of new concepts in micronutrient adequacy and health optimization. Just so you don't get terrified of this presentation title, it's basically why you need vitamins and nutrients and why it's likely you're probably not getting them in your diet. I must give you a disclaimer that the Pharmanex supplementation that I will be talking about at the end of the talk and the BioPhotonic Scanner, which I will also be talking about, neither of them are FDA approved for the diagnosis, treatment, prevention, or cure of any disease or medical condition. Supplements and vitamins and minerals are appropriate to support the structure and function of the human body, however. So let's begin talking about the physiology of micronutrients and deficiency syndromes. This article, called Low Micronutrient Intake May Accelerate the Degenerative Diseases of Aging Through Allocation of Scarce Micronutrients by Triage, kind of a mind-numbing title, by Bruce Ames, is actually quite interesting. It reminds me of the old TV show MASH, where the wounded were coming in from the Korean War, and they were triaged, as in this person is okay and can hang around for a while. This person is really sick and needs to be operated on now, and this person is a goner and there's nothing that you can do. Similarly, the body allocates the micronutrients that it has at its disposal by triage. And what Ames is talking about in this paper is that if you don't have an adequate intake, then your body will allocate those nutrients for key important functions like breathing, thinking, filtering in your kidneys, detoxing in the liver, etc. The body will not use them for stabilizing your DNA from oxidative stress. Your body will have increased mitochondrial decay, etc. So low micronutrients are okay as long as you just want to live and take care of critical things. But if you want to live a long time and hopefully disease-free, this paper speaks to the need for adequacy of micronutrients. Similarly, Fletcher and Fairfield, publishing in the Journal of the American Medical Association all the way back in 2002, took note of the fact that in general in this country, our diet is adequate to keep us from having frank deficiency diseases like scurvy and rickets. However, it is not adequate for optimum nutrition, and their conclusion was, pending strong evidence from randomized trials, it appears prudent for all adults to take vitamin supplements. I thought that was interesting. And then more recently, I studied this paper, found it on PubMed using the search vitamin and nutritional intake for 2003 to 2006. And it's an interesting paper, and what it breaks down to is this. This is the result of that paper. The percent of U.S. residents who are over 2 who are deficient in vitamin A, C, D, E, calcium, and magnesium. The conclusions by Fulgoni and colleagues were, without enrichment and or fortification and supplementation, many Americans did not achieve the recommended bare minimum micronutrient intake levels. So we know from Ames that if you don't have enough micronutrients, bad things can happen, and this is suggesting that there are quite a few of us that do not have adequate micronutrients. And then finally, for those that say vitamins don't work and they're just a waste of money, I can tell you that 2 recent studies have been seriously methodologically flawed. But this one by Thomas and colleagues in American Journal of Managed Care was remarkable. And this was the impact of oral nutritional supplementation on hospital outcomes. In other words, how likely it is that some hospital patient that comes into the hospital and is on a good quality multivitamin, multimineral supplement and stays on it, how likely is it that they're going to do better? And in fact, they did. They spent 2.3 days less time in the hospital, saving $4,734 cash money, cash savings per episode as a result of that shorter stay. And they also had a 2.3% reduced probability of early readmission. And the conclusions were that the use of oral nutritional supplements decreased the length of stay, episode cost, and 30-day readmission risk in the inpatient population. So let's talk about these vitamins and mineral supplements. Here are some of the critical trace and essential minerals that are required, and the ones that are in the tan color are actually included in LifePak and LifePak Nano and the LifePak line from Pharmanex. This is the percent mineral depletion from the soil during the past 100 years by continent, and what this is showing is that we are leading the world again, this time in a bad way, with 85% of the minerals completely removed from our soil in this country where we're growing our crops and food. So even if you eat totally organic, you may still be getting essential mineral and trace mineral deficiencies. And then when we look at what's been going on in the last 40 years in vitamin D and iodine, we see that now we have 2 to 3 times less vitamin D, which is available to our population, and we're getting 4 times less iodine than we used to get. So let's talk about one of the key minerals that we need in our diet, magnesium. And you can see why the golden arches are there, because if you have a lot of processed food or stress, magnesium is one of the first minerals to disappear. It is decreased by alcohol consumption, caffeine, sodas, and different medications. Unfortunately, it's not good to be without it because it's your anti-stress mineral. It decreases cortisol release, it relaxes muscles, prevents cramps, and decreases anxiety, and it improves sleep. Here are some symptoms of magnesium deficiency. On the left are things that I typically deal with in psychiatry and functional neuropsychiatry. But then on the right, you have health conditions associated with magnesium deficiency, all the way down to PMS, fibromyalgia, fatigue, and constipation. And as I'm fond of saying, if you don't have magnesium, you don't poop well. So a lot of people have problems with regularity, as they say, and magnesium is a critical component. And then in mental issues, it is a key nutrient. Selenium is another key element that we need in our diet, and we have a huge deficiency of it in a lot of the soil in this country. And this study by McCann and colleagues in the FACEB journal noted that modest selenium deficiency may increase the risk of diseases of aging. Now, this is one reason, and I know it looks complicated, but it's actually very straightforward. Your thyroid gland, which is labeled right there in the middle, secretes thyroid hormone. And thyroid hormone is metabolized to free T3, the foot soldier of the thyroid, with an enzyme which is selenium dependent. You have to have selenium to make free T3, and if you don't have enough free T3, you're essentially functionally hypothyroid. That's one of the reasons why people that get started on LifePak and LifePak Nano start feeling perkier, is because if they had a selenium deficiency, now they've got enough selenium to be a cofactor with that enzyme and have this reaction take place. And then also LifePak and LifePak Nano have 76% of the recommended daily allowance for iodine, and you have to have that to make thyroid hormone to begin with. So it's kind of a twofer for the thyroid optimization. Here's something else on selenium. This is a concomitant evolution between lowering of your plasma selenium and during that same 9-year period, a cognitive decline. And this collation of these suggested that the optimal selenium status is potentially important to maintain neuropsychological functions in aging people. In other words, your memory, your cognition, and so forth. Now let's talk about vitamins before we end this, and we'll take this up in part 2. Vitamins are essential nutrients, and if you have a vitamin deficiency, you have classic or obvious diseases, and you can see some of them there: goiter, scurvy, osteoporosis, pernicious anemia, etc. B12 deficiency is a critical deficiency, and many people are giving it to themselves now with the over-the-counter proton pump inhibitors like Prilosec, which Larry the Cable Guy is now pushing on TV. So on the left side, you see the mental symptoms that can happen with B12 deficiency, and on the right side, you see the physical symptoms, including chronic fatigue, tremors, GI problems, etc. And we have also found that when you supplement with a good quality vitamin B complex, it improves people's dealing with stress at work. And this study showed that the vitamin B complex treated group had significantly lower personal strain and a reduction in confusion and depressed and dejected mood after 12 weeks. And LifePak Nano are loaded with B vitamins. Let me wrap up B vitamins before we end it today, and then we'll take it up with part 2. So this looked at lowering this chemical in the blood called homocysteine by use of B vitamins. And this study found that the accelerated rate of brain atrophy in the elderly with mild cognitive impairment could be slowed by treatment with homocysteine-lowering B vitamins. And not only can you slow the accelerated rate of brain atrophy, but you can actually slow the cognitive and clinical decline in people with mild cognitive impairment as well. This was another analysis of the same data, the VitaCog trial. And one more. This is vitamin E, which is an antioxidant, but it's a vitamin, prevents the high-fat, high-carbohydrate diet-induced memory impairment. I thought this was fascinating. So if you have high-fat, high-carbohydrate diet, think Big Mac, shake, and fries. That gives you increased oxidative stress, which actually damages your brain and has you have a decline in cognitive function. So when you consume vitamin E, it normalizes the effect of the high-fat, high-carbohydrate diet on stress markers. Now, this is not a get-out-of-jail-free card for eating what you want, but it's helpful to know that this is a useful vitamin. And then before we end today, this is what's in LifePak Nano when you take 2 packets per day. You have the homocysteine-lowering B12, B6, and folic acid. B12 is 1,000%, so it's more than adequate. You've got good levels of magnesium, 100% of zinc, and zinc is required in men to make testosterone. That's another reason why men who start LifePak and LifePak Nano have more energy, is they're probably making more testosterone. There's the selenium and iodine that we talked about. Chromium helps regulate blood sugars. Vitamin C is a key antioxidant, and vitamin A, as we'll see next time, is a key antioxidant. So at this point, I'm going to pause it, and we'll take it up in part 2 next week.